Hello everyone. Let's discuss about the next practice-based questions. So our first question is, a patient experience abdominal discomfort and watery stool leakage from their rectum should be aware that these symptoms could be indicative of option 1 constipation, diarrhea, bowel incontinence and fecal impaction. So in this given question, we have to find out the condition in which the symptom, that is the leakage, means watery stool leakage from the rectum, and abdominal discomfort means sign and symptoms are given, and we have to find out the disease condition. So let's solve this question. Okay. So basically, firstly start the right answer is the fecal impaction. How the fecal impaction is the right answer here? So let's see. Fecal impaction, also called as the impacted ball, is defined as a solid immobile bulk of the feces that can develop in the rectum as a result of the chronic constipation, and it results from the neurogenic bowel dysfunction. So you can see here, basically the fecus impaction is also called as an impacted ball. And when the patient having the chronic constipation, you can see here, the fecal material can lead to the impactions here. So hard fecal material or the solid immobile bulk feces developed into the rectum, and these can be stuck into the rectum due to the chronic constipation. So this is known as the fecal impaction, means the feces cannot pass through the rectum, and it can be, you can say that the main etiological factor of this, so it can result from the neurogenic bowel dysfunctions. When our bladder bowel axes are not functioning properly, so it can lead to the fecal impaction. So what will be the sign and symptom of the fecal impactions? So see here, the main clinical manifestations. So firstly, the fecal incontinence means the paradoxical overflow of the diarrhea or the watery stool as a result of the liquid stool passing around the obstruction. So you can see the diagram here. Yes. So you can see here, this is the rectum here, overstretched rectum due to the presence of the fecal material. So this is the hard fecal material. So due to the presence of the hard fecal material and the impaction of this fecal material, it is the impacted or the overstretched rectum. So here lot of the hard fecal material here, and you can see here there will be the paradoxical overflow of the diarrhea. So the liquid stool can lead to leak from the rectum. So you can see here, when this leak from the rectum, it passed through the anus, and we can call is that the fecal incontinence. We know the condition like the incontinence of the, like the urine incontinence, means here the dribbling of the urine. Okay, so same condition as the fecal incontinence, in which due to the hard fecal material impaction, the liquid fluid will be the overflow from the anus. So this is called as the fecal incontinence, where the paradoxical overflow of the diarrhea as a result of liquid stool passing around the obstruction. So this is the first and the clinical sign and symptom. So we can say that this is the clinical sign and symptom of this disease as given in the question. So what was in the questions? Like the leakage of the diarrhea or leakage of the liquid stool around the obstruction site. So it is the clinical sign and symptom of the fecal incontinence or the fecal impaction here. Then let's have an overview of the other symptoms. So client will have the vomiting, anorexia, abdominal pain, and constipation. So we can say that the other often symptom experienced by the client is like the bloating, urge to push, nausea, vomiting. And the client have an urge to push, he will suffer from the vomiting or the abdominal pain. And it can be or lead to the constipation. Constipation can be the cause of the fecal impaction, and that can also be the symptom of the fecal impaction. So here we know some of these symptoms like vomiting. So nausea and vomiting when the client is suffering from the chronic constipation. he or she will not able to take food, and when he or she will try to take food, then he can experience the vomiting here. Then the anorexia. Whenever the client is suffering from the fecal impaction or the constipation, client will not able to eat as per their daily requirements or the daily diet. So he will suffer from the anorexic conditions. Here the abdominal pain. So why the pain in abdomen? When the client take efforts to push out that the fecal material, so he will suffer from the abdominal pain. And abdominal pain also lead to the improper functioning of the bladder wall axis or the chronic constipations. And here the constipation. So these are the other sign and symptom of the fecal impactions. So we have discussed about the clinical symptoms of the fecal impaction and the definition of the fecal impaction. So let's solve this MCQ by the right options here. Yes. So right option will be the fecal impaction. Constipation can be the leading cause of the fecal impaction, and in constipation there will be like watery stool leakage. This will not considered as in all the cases here. The diarrhea is an inappropriate option. Bowel incontinence is also an inappropriate option. So right option here, the fecal impaction, because these symptoms like the abdominal pain or the discomfort and fecal incontinence in where the paradoxical overflow of the diarrhea. So these two symptoms are the classical symptom of the fecal impaction. So right option here will be the fecal impaction. So this is all about this MCQ. Next MCQ here. What is the client first step when learning the proper technique of the descent stair using axilla crutch after being placed in a leg cast due to the fracture in the right tibia? So option 1 here, the place both crutches on the first step, place the left foot and right crutch on the first step, place the right foot and the left crutch on the first step, and place the right foot on the first step. So see here, this is the question regarding the body mechanics. So here the normal body mechanics, and when the patient's suffering from some musculoskeletal abnormalities. So this is a condition given, that is the here fracture of the right tibia. So fracture of the right tibia, and patient is learning the proper techniques to the descent. Descent means downstairs. Okay. So when patient is on the downstairs, then how he will use the axilla crutches after being placed in a leg cast due to the fracture. So means patient having the leg cast and he has a fracture on the right tibia and he is downstairs, like he is coming to the downstairs. So what kind of the technique he will use? So let's have an overview of the firstly the normal body mechanics. So body mechanics involves the coordination efforts of the muscle, bones, and the nervous system to maintain the balance, posture, and alignment during the moving, transferring, and positioning the patient. Proper body mechanics allow individual to carry out activities without exercise, use of energy, and help prevent injuries for the patient healthcare provider. So this is the normal body mechanics and the like the basic introduction of the body mechanics. So here, how to use crutch when patient having the different positions, like if he going to sit, going to stand, what kind of crutch he will use and what kind of measures he will use in the this condition here. So you can see here, like this is going downstream with the crutches. So you can see here, patient is placing both the crutches on the first step. So you can see here. Then second is going upstairs. He ascending the upstairs here. So you can see here, like the injured leg, he will also the using the crutch, axilla crutch, and injured leg is placed behind and firstly the unaffected leg. Then here the walking with the crutch. Then other is sitting down with crutches and standing with the crutches. So these are the basics of the use of the crutch during the walking, sitting, standing, upstairs and downstairs. So our question is about the downstairs. So this is the exact right answer here. You can see here. When descending the stairs with the crutches, the proper technique involved first placing, you can see here, first placing both crutches. You can see here, first placing both crutches on first step. Okay. I'm telling about the downstairs. Okay. So our question is about the downstairs. So right answer here, like placing the both crutches at the first step, and then the unaffected extremity should be positioned followed by the unaffected lower extremities. So you can see here, like the affected extremity should be positioned followed by the unaffected extremities. So you can see here the plaster cast is applied on this individual and he is placing both the crutches at the first step. So this is about how to like teach the patient, or how the patient learns when he or she having the plaster cast on the leg and he is downstairs. So this is the right answer here. Other image you can also see. Yes. So injured leg followed by the uninjured leg, and we can use the both crutches at the first point. So let's solve this MCQ by clicking the right option here. So option number first will be right. Place both crutches on the first step. So I have explained you with the help of diagram. Like when descending stairs with the crutches, the proper technique involves first placing both the crutches on the first step. Then the affected lower extremity should be positions followed by the unaffected extremity. So right option here, 1. Second option is inappropriate because he is telling about the place the left foot and the right crutch on the step. So it is inappropriate option here. And the left foot and the left crutch is also an inappropriate option here. And the right foot on the first step is also an inappropriate option. So right option will be option number 1. Next MCQ. Which of the following equipment option will assist a patient with a total hip replacement in performing ADL, activity of the daily living? Option A, abduction pillow. Option B, high seat commode. Then the recliner and spinal traction system. So condition given as the total hip replacement, and we have to find out the equipment in the given options that will assist the patient in daily activities. Okay, so activity of daily living, we can see like what are the activity of daily living. We know like the taking a bath, go to washroom for the refreshing, or the brush, bathing. All these are the activity of the daily living. So let's solve this MCQ by finding the right option here. So firstly, see here. Okay. So abduction pillow is used to prevent the hip abduction, potentially prosthetic dislocation. So it is not that much important in the activity of daily living here. And second option here, we know that the recliner and the spinal traction system. So these also are the inappropriate because recliner is can be helpful in preventing the excessive flexion. We know all that about the recliner. So it prevents the excessive excessive flexion. And spinal traction system also. So both these options and abduction pillow, I have explained you that abduction pillow help to prevent abduction of hip. Okay. So option number 1, option number 3, and option number 4, these are not that much interlinked with the activity of the daily living, because all these are preventing, like the abduction pillow prevent the abduction of hip, and recliner prevent the excessive flexion here, and spinal traction system This is a help to support the spinal cord. So we can say that these three options are the inappropriate. So let's see about the second option. How can be the second option is right option here? So firstly, see here the total hip replacement. So hip replacement, also called as the hip arthroplasty, is a surgical procedure to address the hip pain. The surgery replaces the part of hip joints with the artificial implants, and the hip joint consists of a ball and a socket. So this is about the just introduction of the hip replacement. So second option is the high seat commode. How it can be helpful. So we can see here, like this is the exact diagram or the exact picture of the high seat commode and the patient with the total hip replacement, how he is assisting his activity of daily living. That is the, you can see here. So we know a high seat commode which keep the hip higher than the knee. So you can see here, this is the exactly diagram of the high seat commode. So it can help in the hip higher than the knee and an abduction. So you can see here that it can prevent the, you can see here hip positions or any complications in the total hip replacement here. So high seat commode is the right option here. It keep the hip higher than the knees rather than the other seats. In the other seats, we can say that the it cannot that much helpful in the knees for the keeping the hip higher than the knees. But high seat commode is mainly used in the total hip replacement for assisting the activity of daily living using the toilets. Okay, brushing, bathing, all these are the activity of daily living, or we can say that the basic activities of the human. So this can be, other options are also appropriate for the total hip replacement, but in question we have to find out the right option regarding the activity of daily living. So toilet seat is the use of the toilet seat is the daily activity. So this is the right option here. So we can say that the B option is the right option, because the high seat commode keep the hip higher than the knees. And we know the abduction pillow that I have explained you earlier. It helped to prevent the hip abduction. And other the, we can say that the recliner. So recliner also help to preventing the excessive flexions, and spinal cord traction system is supporting. So it is the appropriate option for the assisting patient in the activity of daily living. So option B is the right option. The next question here. A patient is admitted to the hospital with a burn injury and is the process of recovery. The healthcare team want to ensure the patient nutrition support healing. Considering the patient condition, which meal option would be the most suitable to the promote healing of this individual? Yes, so we know the condition given here, the burn injury. Okay, in the question given the burn injury here, and in the injury, sorry, in the burn injury, in the question asking about the nutritious diet of the patient, means which kind of the diet or which kind of the meal option would be the most suitable for promoting healing of this individual. So we have to find out the nutritious diet that help in healing or that promote the healing of the individual. So let's see the options. Chicken breast, orange, kiwi, milk. Second is pasta, marina, garlic bread, peanut butter. Third option is the ginger ale and the jelly sandwich, banana and the coffee. And the fourth option is pork chop, fried potatoes and the tea. So let's solve this MCQ here. Okay. So basic concept of the here, the healing. Okay. So we know whenever any individual is suffering from the any burn or any kind of the surgery, and he have in the healing or the recovery period, then the our nutritious diet has put the main impact. So wound healing, specifically we know what kind of things are necessary for the healing. So we know vitamin C and some of the protein rich diet. Okay. So vitamin C and protein rich diet are very much useful for the healing of the wound. We know that the vitamin C or the ascorbic acid, it plays two main important role. So we know the ascorbic acid plays important role in the, firstly in the iron absorption. Okay. And the second here, the healing of wound. So patient is having any type of the wound, or he or she came from the surgery, or he or she in the post-op period, then we mostly recommend the patient the vitamin C diet. And proteins, we know what are the main function of the proteins. So we know proteins are the basic bodybuilding, means protein help in the bodybuilding and the tissue repair. So during the injury, when we know there is a lot of the injury lead to the epithelial tissues or other type of the tissues here. So for the tissue repair or the regeneration of the tissues, protein will play an important role. So here these two nutritious elements are very much important in the healing of the wound. So vitamin C and the proteins. So in question, we have to find out the some food groups in which both the things lead. Okay, so we know milk, chicken breast, orange, and kiwi. These all options are the right options. So how? So see here, chicken breast. So you can see here the chicken breast is highly rich in protein. Okay, so if the chicken breast is highly rich in protein, so we can consider is the right option. Orange here. So we know orange are the comes under the category of the citrus fruits, and we know citrus fruit give us vitamin C, and it also having the fibers. Okay. Then here next the kiwi. It also consists of the vitamin C, and milk is highly rich in protein. So these four food groups, chicken breast, orange, kiwi, and milk, these food groups are appropriate that covering the proteins and the vitamin C. Vitamin C. So we know these two components, protein and vitamin C, plays vital role in the body healing process. Protein aids to the tissue repair that I have explained you and regenerations, and when vitamin C support the collagen synthesis and the immune system. So like the protein and milk come under the protein food categories, and kiwi and orange comes under the vitamin C categories that help to support our immune system and as well as the collagen synthesis. So these all are the right option here. So let's find out these options in the questions. So these options included in are the first option. So we can say that the right option here will be the option number 1, chicken breast, orange, kiwi, and the milk. So we know that the other options are inappropriate because these not consist of these two requirements completely, the protein and the vitamin C. So option number first will be the right answer. Chicken breast, orange, kiwi, and the milk. So this is all about the today's session or the today questions. Hope so you all able to understand my questions. Thanks for watching.